Matthew, why do we need Medicare for All?
It would allow all Americans, regardless of their income, to get the health care they need when they need it. Medicare for All is the most cost-effective health care plan. We'll be able to save up to $500 billion yearly under Medicare for All.
Let me thank all of you, not only for being here today, but for your work over the years for human rights. And there is no human right that I know that is more important than to say loudly and clearly, health care is a right of all people, not a privilege. And Roseanne is absolutely right. All of the pundits always tell us what we cannot accomplish until the day after we accomplish it. And that's been the story of struggle, civil rights struggle, women's rights struggle, gay rights struggle, disability rights struggle. Can't be done, can't be done, can't be done. But I'm here to tell you that what can be done is that we end the international embarrassment of the United States of America, our great country, being the only major country on earth that does not guarantee health care to all people as a right. And together, we are going to end that embarrassment.
Yes. Why is being uninsured a problem?
About 44 million people in this country have no health insurance, and another 38 million have inadequate health insurance.
The ugly truth is this: health care is not treated as a human right in the United States of America. This fact is outrageous. And it is far past time that we change it. Say it loud for the people in the back: health care is a human right. For my family, although we have comparatively good private health insurance, ALS now means paying out of pocket for almost 24-hour home care. This costs us $9,000 every month. The alternative is for me to go on Medicare and move into a nursing home, away from my wife and my son. So we are cobbling together the money from friends and family and supporters all over the country. But this is an absurd way to run a healthcare system. GoFundMe is a terrible substitute for smart congressional action. Like so many others, Rachel and I have had to fight with our insurer, which has issued outrageous denials instead of covering the benefits we paid for. We have so little time left together, and yet our system forces us to waste it dealing with bills and bureaucracy. That is why I am here today, urging you to build a more rational, fair, efficient, and effective system. I am here today to urge you to enact Medicare for All.
What are the benefits of Medicare for All?
Medicare for All would cost less, reduce health disparities, prevent medical bankruptcies, and help small businesses.
As a registered nurse, how do you think Medicare for All would be beneficial?
Well, I think Medicare for All would be one of the first steps in the right direction for healthcare. I work in an acute care hospital and I take care of a lot of really sick patients. Sometimes on discharge, the patients will be referred by the doctors to go see other doctors or specialists. But what I hear from them when I tell them and go over the instructions with them is that it's not going to be possible because they don't have insurance, or lots of times even if they do have insurance, their deductibles or copays are so high they can't be seen. So unfortunately, a lot of people can't get the treatment that they need because they have no insurance or their insurance isn't good enough. So I think Medicare for All would be a step in the right direction.
How many Americans have no health insurance?
44 million Americans are uninsured, and 8 out of 10 of these are workers or their dependents.
We have heard, we all know the tragedy that exists when people have no health insurance or when they are underinsured. The nurses here know it perhaps better than anyone else. You talk to nurses and you talk to doctors, and you know that every single year, thousands of our fellow Americans die because they don't go to the doctor when they should. And then the doctor and the nurse say, well, why didn't you come in when you were first sick? And they say, well, I didn't have any health insurance. I didn't have any money. Or maybe I did have insurance, but my deductible was so high, I just couldn't afford to take the money out of pocket. That should not be the case in America. When you're sick, you should go to the doctor. When you go to the hospital, you should not come out in bankruptcy. Now, all of us know, and we're here today to mark the 50th anniversary of Medicare, one of the most successful programs in the history of the United States. And let's remember, let's never forget the situation before Medicare was established. And that situation was that if you were old and sick and poor, you had no options. You died or you suffered. And Medicare has gone a long, long way in addressing that issue. Today, thanks to Medicare, 51 million seniors and people with disabilities have health insurance coverage. The senior poverty rate has plummeted, and seniors are living healthier, longer lives. We must never, ever go back to the days when older Americans could not get the health care they needed because they could not afford it. We are not going back.